Welcome back. You're still watching All Angles on ENCA. Now, the UN's Economic Commission for Africa and the African Business Coalition for Health will be hosting the Africa Investment Summit on the 20th of this month. This summit aims to help businesses, government and researchers develop strategies to increase access to quality and affordable health supplies in Africa. Joining me now is ABCHealth Chairman Aigboje Aig-Imoukhuede. Thank you very much, Mr. Aig-Imoukhuede, for your time on ENCA. Now, firstly, this summit is obviously very important, especially looking at how our African leaders were trying in world stages to ask them to please, basically begging them to remove patency of vaccines.
Well, thank you. Thank you for having me. Yes, there's a lot happening in the health space. Certainly, the COVID pandemic is the most high priority for everybody in the world, and Africa is no exception. You know, as you've raised around the issue of vaccines, vaccine equity or vaccine inequity, as the case may be, and vaccine hesitancy seem to be Africa's greatest problems at this time. And it brings to issue this big question of local production, local manufacturing, and the fact that if our life-saving medicines and life-saving equipment, you know, basically come from outside, and we have pandemics that affect the whole world, we may be left alone, in a sense, as we find ourselves as Africans right now.
And of course, COVID-19 has highlighted how Africa needs to start producing its own so that people can actually have access to that quality healthcare service that is equal to everybody.
Yeah, I mean, certainly, you know, the one fundamental right, apart from the right to life, or which is linked to health, is that each citizen of the world should have access to basic healthcare at an affordable level. And this is one of the things that in Africa we find most unacceptable. The fundamental measurement of the quality of life starts with health, actually. And, you know, Africa suffers the most, you know, across all measures of humanity when you measure the quality of healthcare, you know, that goes to ordinary African citizens. This is why we at ABCHealth, which is a coalition of businesses led by the Dangote Foundation and GBC Health, which is the Global Business Coalition for Health, which I co-chair, came together and partnered with the UNECA to basically catalyze and mobilize governments, business and finance, you know, towards, you know, manufacturing our medicines and manufacturing our basic medical requirements, syringes, needles, and all the things that you require, you know, to either prevent or to fight, you know, health problems. Let me tell you something very interesting. You know, my background is finance. A lot of my time was spent as a banker. And across Africa, I have seen what happens when hitherto unexplored space, you know, is filled when you have the political will, you have the business community, particularly the entrepreneurs, you know, coming together along with the bankers and the finance people to say, look, let's fill this space. If you think, for example, about manufacturing for cement, you know, and 20 years ago, local manufacturing capacity was frankly speaking, was minuscule compared to the demand. And, you know, we were importing all our cement from all parts of the world. And today, you know, you have local manufacturers, you know, importing most of the cement that is consumed on the continent. And our continental, you know, demand has grown, you know, multiples. Now, just imagine if we continue to depend on imported cement, you know, for our development and for our roads and infrastructure across Africa. So the paradox here is this, you know, Africa bears the brunt of the disease burden, okay? We have a market of 1.38 billion people. That's the second single market in the world, you know, after China. And yet, okay, most of our medicine, given this huge, you know, business opportunity, comes from outside. So we have to basically mobilize our African businesses and outside investors to say, look, come and look at this opportunity and let's do something about it. Let's save lives together and make profits in the process.
Let's talk a little bit about the summit itself. When will it start, and are there already African manufacturers who have business proposals in place to basically pitch for the finances to be able to produce our own here?
Okay, so the summit kicks off just before the UN General Assembly this year. So we on the 20th of September. And the structure of the summit is it's a gathering. It's a gathering of government leaders, a number of African heads of state who get it and who are pushing, the local manufacturing and agenda. We've invited a number of entrepreneurs in the health space, including health tech entrepreneurs, a number of businesses, including, of course, even global pharma businesses and so on. And of course, the bankers, the private equity and asset managers, and I note, the Afrexim and the ADB, as powerful leaders in that regard. And the way it works is that we put everybody in the room. I think largely virtual because the UN is not hosting meetings apart from the General Assembly itself. And the whole idea is that we will examine specific value chains. Just in the same way as if I had a manufacturing gathering, 25 years ago, one of the value chains we would certainly examine at that time would have been cement. And so we have a number of value chains that we're going to go through, and we're going to look at the opportunities within those value chains for investment. And I think very, very strongly that the main reason why we are not seeing the type of investments coming into the health space in Africa is simply the fact that we haven't sold the opportunity well enough.
All right, very, very important summit and step indeed to Africa's very long journey to total liberation. That was ABC Health Chairman Aigboje Aig-Imoukhuede. Thank you.